Welcome to Frederick Dental Clinic. My name is Heraclio. I'm a Brazilian orthodontics. I graduated in dentistry in 1996, and then straight after that I went into ortho, and then I've been specialized in orthodontics for I'd say the last almost 20 years. And then I came to Ireland to learn English, and now I'm able to practice here in Ireland, and that's been 2 years now that I've been practicing dentistry and doing my orthodontics, which I love. When it comes to metal braces or cosmetic braces, fixed braces in general, I'd say the best thing for you to do is, if you're at home watching me, give us a call and come in for a free orthodontic consultation. At that appointment, I will discuss all the options. I will talk to you about time frame. I will talk about prices. I will talk about braces options for you, metal, clear, aligners, whatever you would like to know about. You can ask me as many questions as you want. We can show you results that we have similar to your case, and we can go through all of your questions, okay? The first thing would be that. Second thing would be get an x-ray for us to assess the roots and the bones that you have, and check for decays and check for any dental treatments that you have to do before the braces, or even a cleaning. We can do it all for you here in our clinic. Everybody can have braces, doesn't matter how old you are. There are things that we do on teenagers, young adults, even if you are like over 60. I have patients that are over 60 and they want to have a straighter smile. And why can't they have? Because it's a teenager thing? That is not true. You can have braces at any age you want. Time frame, braces can take up to 36 months in the worst case scenario. If we're talking maybe about a severe case that will need extractions to create space, that has a very overcrowded mouth, and then it can take up to 36 months. But most of the cases, they take about 18 months-ish. You'd be surprised sometimes we finish treatment even in less time than 16 or 18 months, okay? Metal braces, they are a bit faster than clear braces. So if time is an issue for you, you have to consider the option of going with metal braces. The procedure is very simple. After you have your x-ray taken, you come back for a second consultation, and then we're gonna take all the records we need. We're gonna take photos of your teeth, photos of your face. We're going to assess your x-rays. We're going to discuss the findings with you, and you're gonna let us know what you want, and I'm gonna let you know what I can and can't do. And that's one thing I'm very honest about. There are things in orthodontics that are undoable and unreasonable. But there are things, and you'll be surprised with some of the results we have, that just will make your life a lot better, because you'll be more confident with your smile, you'll be a happier person, and more smiley, and just better quality of life in general. When you have your braces on, what you have to do is come to your appointments, which are usually every 6 weeks-ish. And of course, your job at home is to take very good care of your braces. So you're gonna brush your teeth very well. We'll teach you how to brush. We'll teach you how to floss, or sometimes use interdental brushes instead of flossing, which may be handier. We'll teach you what you're allowed to eat and not allowed to eat. We'll give you all the information about emergencies with braces. If something breaks on you, if something slips off on you, what to do, you can just give us a call, pop in, we'll fix that for you at no extra charge or anything. So the first 2 weeks after you have your braces on, that's when all the things happen, because you don't know how to deal with the braces. After that, you will be grand. And the benefits of the treatment: imagine yourself that don't want to smile because you are ashamed of your teeth position, or the shape of your teeth or your smile line, it doesn't matter. Imagine how different would your life be if you had straighter teeth, brighter smile, and fuller smile and all of that. So I think the benefit of the treatment speaks for itself. Okay, so how do braces work? We are going to have an x-ray of your teeth, and we're going to bond the brackets. The brackets is the little metal piece that you guys call train tracks. So we're gonna bond that little piece on each individual tooth of your mouth according to your tooth position on the x-ray. And once that part is done, we're going to run a wire across all of the brackets in your mouth and tie the wire with the colored elastics. Of course, if you like colors. If you don't like colors, you go for silver colors if you're having metal braces, or you go for clear elastics if you're having cosmetic braces. The wires are going to put pressure on the brackets and move your teeth around. That's more or less the mechanics of orthodontics, okay? We could go through more details if you like that topic when you come here to visit me. How long do braces take? Brace, like a mild orthodontic case, can take 12 months to 18 months-ish. A moderate, I'd say 18 months to 24 months, and a severe case can go up to 36 months. In the beginning of your treatment, we'll discuss that, and so that you don't get surprised if your treatment is lasting too long or too short. Metal braces are self-explanatory. They're made of metal, so they're made of silver, like stainless steel. And cosmetic braces are made by porcelain or sometimes composite, so they are clear and they're very transparent, which may sound very appealing to start off with, but sometimes they stain, sometimes they break because they're more fragile than metal braces, but we'll discuss options for you when you're here. Now, do I need braces? Now, it may sound a bit strange what I'm gonna tell you, but that is really personal. Braces nowadays is considered to be cosmetic, much more than an actual treatment for your bite. And then when it comes to cosmetics, it's all about how you perceive yourself when you look in the mirror, how self-conscious you are about your teeth. If there's anything that annoys you, crooked teeth, overcrowding, gaps, or some people, they get annoyed with a midline shift, for example, or even a bite that you can't seem to get right, or anything, give us a call and book in for an ortho assessment, and we'll discuss options with you. If you ask me what is the best orthodontic treatment when it comes to leveling and alignment of your teeth, I'd say metal braces. They are the best. And why is that? They are the most cost effective. They are the least expensive. They are the most resistant. They are the ones that I can control better, the movement, and because porcelain with a cosmetic bracket can wear off a little bit, and then metal braces don't. And then if you think about the mechanics itself, we have a metal bracket and then we have a metal wire sliding on the bracket. So that makes everything faster for the patient and for me. So this is definitely the best. When it comes to procedure, it's the same procedure whether you're having metal, whether you're having cosmetics. Aligners is a bit different. I'll talk to you about it in the next video. But metal braces is, you come for an assessment, I'll ask for x-rays, I'll take all the records I want, we'll do a session of treatment planning, so you tell me what you want and I'll tell you what is possible to be achieved with braces. And then you are going to book for your bond up. That's when your actual braces go on. And then we bond your upper braces. Usually we start with the upper teeth. We leave them on for about 6 weeks or so. And then on your following appointment, that's when your lower braces go on. I don't like putting both upper and lower braces all at the same day because I just think it's too much for the patient to get used to in such a short amount of time. And then we'll put the wires, and then the magic starts to happen because the wire starts moving your teeth around. You go home, you may experience a little tenderness because of the pressure from the wire in the bracket, and it's not gonna be painful at all. I promise you that. We don't put a lot of pressure. Actually, the best results are always achieved by low pressure, not a lot of pressure. So we'll be very gentle with you, no need to be afraid of anything. And then your appointment will be pretty much during the reviews. All I have to do is remove the elastic band, remove the wire, check. I always check for decays, I check for fillings, I check your hygiene. I'll give you instructions about the hygiene, and then we'll change the wires, we'll tie them back with the color you choose, and until the end of the treatment. When the treatment is finished, we remove all the brackets, we polish your teeth, we leave them spotless and smooth for you, and then we will offer you retainers, which you can decide between fixed retainers, a bar bonded to the back of some of your teeth, or removable retainers, just a plastic tray that you're going to wear every night for as long as you want your teeth straight. And that's very important. That's the third phase of an orthodontic treatment. That's the retainer phase. And that is done by you at home. The retainers need to be worn every night until you want your results to be stable. If you'd like to become a patient, all you have to do is give us a ring at 01-878-6999 or email us and call in if you want in person. Your first consultation will be free of charge. We'll request an OPG, an X-ray, and we'll chat about treatment plan options.